Good. Good morning, PT on Ice Daily Show. YouTube is live and now Instagram is live as well. Good morning. Again, PT on Ice Daily Show. Welcome to Clinical Tuesday. I will be your host, Dr. Lindsay Huey. I am so happy to be with you today on a Clinical Tuesday. It's my favorite day of the week. Thank you for allowing me to host us early at 8 a.m. 2 weeks in a row. Have some patients a little earlier today that want to get in. So thanks for that understanding. Today, I'm going to speak with you about lower quarter resilience 101, the deadlift. And specifically, I want to speak to two things about it: resilience, and then just generally how rad the deadlift is. Before I dive into that and let you know how those pair so nicely, being resilient in your lower quarter and the deadlift, just want to talk a little bit about some courses that Mark and I have coming up. So we have courses again all over the country, but the most recent one coming up is in Maryland, July 16th, 17th. We'd love to see you there. And then the next one is August 6th and 7th in Arizona. Yes, a little bit hot weather expected, but we are going to have a blast. So please join Megan Daly and I there. We are sure to get our wads in and some hikes before and after. If you are joining that course, let us know and join us there. And then again, we continue on. So please check us out on ptonice.com. So, to my favorite topic at hand, resilience and the deadlift. If you've been following along the ice journey for quite some time and frequenting PT on Ice podcast, you have definitely heard one of our divisions talk about the deadlift at some point over the years. When I kind of scrolled through our YouTube channel, there's been tons and tons of episodes on the deadlift, because if you come to one of our courses, you know you're going to learn points of performance and why it is so awesome for our humans. And I can't wait to unpack that for you as to why that is. But specific in extremity management, we really think of it as one of our go-to posterior chain progressions. We specifically teach it in the hip, but we see it beneficial in pretty much any lower quarter condition: hip, knee, or ankle. Before I unpack a little bit more about that, though, I want to just review the definition of resilience. There's a couple definitions when you just kind of look up online and Google it. Resilience is the capacity to recover quickly from difficulties, and it's associated with toughness. The second definition, the ability of a substance or object to spring back into shape. It's elastic and malleable to its environment. Even better, and more enriching the definition to help us appreciate what true resilience is from the APA, so the American Psychological Association. And it says resilience is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to the external and internal demands. Resilience, and think resilience of our patients, think resilience of ourselves as humans. It demands agility in multiple domains, specifically mentally, emotionally, and behaviorally, in response to our environment. And I cannot think of a better movement for the lower quarter that does all of that better than the deadlift. The deadlift makes you purposeful in your environment. It helps train the ability to pick up objects off the ground, not just daily objects like our groceries, our book bag, a bag of mulch, but heavy objects in our world. And it gives us the endurance to pick up those objects that are required of daily living multiple times a day. So you have the ability to build that functionality in your patients. It builds mental and emotional toughness. We all have, that are listening here, have probably either seen a deadlift or done a deadlift, at least one or the other. It requires quite a bit of coordination to move that bar well and move that bar path efficiently. And then when you load it up, right, it challenges that pattern, it challenges that coordination. It is one of those multi-segmental joint lifts that really demands a lot of the body. And I think, unfortunately, it has some fear around it. And I'd really challenge us to think about it not as, maybe it's because of dead lift, but it's a health lift, right? It helps promote health and resilience in our humans. But that mental and emotional toughness piece, when you do get that deadlift just right, you feel so badass. You feel efficient, you feel effective. It feels great. Even at lighter loads, when you are able to maybe do it for longer, right? Move that bar for longer, or that kettlebell, or that heavier um, dumbbell, you feel very mentally and emotionally tough. It's because it breeds confidence. By training it and challenging yourself and your patients to get that pattern down, and then to increase the weight, and then that again, that stamina to keep moving that weight efficiently while maintaining the virtuosity of the movement. A little review of why the deadlift is so amazing. It really involves the whole body. So if we um, think about the science and kind of functionality of the points of performance, you can further appreciate why it is so good from a physical perspective when we think about developing resilience, because it's a function mimicker. So that's set up, right? And let's envision this with a bar, but yes, any object will do, but that bar is the best way to really load up your human and challenge them. So you're going to start out, right? Hip to shoulder width stance apart, hands just outside of your hips, eyes on the horizon. You're going to do a full grip on the bar. And then your shoulders are going to be slightly anterior in front of that bar. Arms are straight. And then you're contacting that bar, really engaging those lats. And then to execute that movement, you will make sure that lumbar curve, that midline is maintained and firing. Your hips and shoulders are going to rise at that same rate. So you're coordinating your body to move and push that ground away as the bar passes the knee. Then the hips will open, the bar will move over, the midfoot the whole entire time and bisect that foot, maintaining heels down. And then that finish is that full hip and knee extension, right? And then return the bar back down. That is a pretty complex movement, right? When you think about all those words, but really, it's just picking an object off the ground, right? So I think while there is some complexity on board when we're thinking about the virtuosity of movement, it really is just picking up an object off the ground, right? You're pushing the ground away. And so it's our job to kind of um, understand all the movements involved for our patients, but then demystify and create a comfort around this movement because it is so impactful in building the whole lower chain. Specifically, it fires up all the things, and we have a systematic review from 2020 to really confirm this. So, Isabel Martin Fuentes in 2020, she looked at 19 studies that met the criteria that they had predetermined. And the conclusions of this study, when we think about the deadlift, and if you've been to CMFA or you've been to our extremity management course, you know this data already. But as a reminder, um, those EMG studies really demonstrate that erector spinae obviously is activated, glute max, and then we also have the quadriceps being a big driver here because it's not a pull from the ground, it's a push. We actually see erector spinae when they did these studies presenting with higher activation than the glute max and the biceps femoris, which might surprise some people because it's typically biceps femoris and glute max are studied, biceps femoris being the most studied. And then it's interesting is the quadriceps actually elicits greater muscle activation compared to the glute max and hamstrings for the deadlift exercise. And then when we look specifically at like hamstring complex, what's firing up the most is semitendinosus over that biceps femoris that's traditionally fired. And the reason I list that out briefly is that is the whole, those are big muscles in the whole lower chain, right? Again, think any hip, knee, ankle, foot condition, and think about how the deadlift could be beneficial for it. We use it a lot. I use it a lot personally in our practice and then in our course. The deadlift is just that go to movement. And if you're not already teaching it to your humans, I would recommend getting on board with this wave of the deadlift. Nothing fires up that posterior chain better. And then that anterior chain. So appreciate that this also fires the anterior chain. teaches the body to coordinate itself, to push that ground away and transmit forces throughout the body. Yes, I have to acknowledge for the person in pain, your deadlift training may start with a lower level version, right? Because we only always meet the patient where their irritability is at. And our number one goal will always be to put the fire out to decrease that irritability. But then we're going to load them up as soon as we can. Right. And this might look like just initially just doing a hip hinge with a band, but it's definitely only always going to lead to the barbell where we can load our humans up and build their resilience. I would argue it's one of the most versatile and integral lifts to know and learn for our humans. And it should be in your repertoire when treating all lower quarter conditions. And while I do not like to should on others, in this case, it's necessary for building lower quarter resilience. If you want to build mental, emotional, and behavioral flexibility to meet the demands of your patient's world, teach them the deadlift and load it up. If you want to learn and experience other posterior chain, lower quarter progressions, please come to an extremity management course. We'd love to have you. Thanks for your time this morning. Have a happy Tuesday.